friends, welcome to Love Medics. This lecture is on cyanosis. Content of the video: introduction, causes, site, mechanism, types, etiology, difference between central and peripheral cyanosis, investigation and treatment of cyanosis. Cyanosis is the bluish discoloration of skin and mucous membrane. It is a condition, not a disease. Causes of cyanosis: the level of hemoglobin is reduced in capillary bed or abnormal hemoglobin derivatives in small blood vessels that leads to cyanosis. Site of cyanosis: they are mucous membrane, earlobe, nail beds, cheeks, lips, tip of nose, tongue, tip of nail and lips. These are the site of cyanosis. Cyanosis due to decreased oxygen level to the capillary. What is the mechanism behind the cyanosis? Low oxygenated blood from the heart, lung to the capillary. That low amount of oxygen also taken by the tissues surround the capillary. So the carbon dioxide level is increased and the oxygen level is decreased. So it leads to bluish discoloration. Increased carbon dioxide level, that is cyanosis. Types of cyanosis: there are two types. One is central cyanosis, other one is peripheral cyanosis. Central cyanosis, it is due to ventilatory problem or circulatory problem, which means lung or heart pathological condition that causes reduced oxygen saturation. The site of central cyanosis are lip, tongue, mucous membrane. Example for the central cyanosis is right to left shunt, which means the congenital heart disease. Because of the shunt, the deoxygenated blood circulated into our body, so the oxygen level is reduced, right? The carbon dioxide level is increased, that leads to central cyanosis. And then pulmonary embolism. Peripheral cyanosis, it has normal oxygen saturation. In this condition, normally the oxygenated blood is circulated from the lung and the heart to the body. If any block in the blood vessel, that leads to peripheral cyanosis. And also increased oxygen extraction from the peripheral blood vessel, that leads to peripheral cyanosis. The site of peripheral cyanosis are distal extremities, which means hands and legs. Example for peripheral cyanosis: exposure to severe cold and frostbite. And if we apply the warm to the extremities, the cyanosis will reduce. Central cyanosis and peripheral cyanosis etiology: decreased oxygen saturation conditions are severe respiratory disorder, pulmonary edema, pulmonary embolism, certain congenital cyanotic heart disease and high altitude. Abnormal hemoglobins are causes the central cyanosis. They are methemoglobinemia and sulfhemoglobinemia. Peripheral cyanosis causes are all the causes central cyanosis that leads to peripheral cyanosis, and also cold exposure or arterial occlusion, venous occlusion, reduced cardiac output, acrocyanosis, Raynaud phenomenon and frostbite. These are the causes of peripheral cyanosis. Difference between central and peripheral cyanosis: in any area, central cyanosis may occur, but the peripheral cyanosis only occur in certain areas. The tongue is involved in the central cyanosis and the tongue is not involved in the peripheral cyanosis. In central cyanosis, we can feel the warm in extremities, and in peripheral cyanosis, we can feel the cold in our extremities. And clubbing is present in the central cyanosis, clubbing is absent in peripheral cyanosis. If we apply the oxygen to the pulmonary causes patient, means it can improve the central cyanosis. If we apply the oxygen to the peripheral cyanosis patient, means not improve the cyanotic condition. Warm application to central cyanosis not improve the condition, and then warm application to the peripheral cyanosis improve the condition. And capillary refilling time is less than 2 seconds in central cyanosis, and capillary refilling time is more than 2 seconds in peripheral cyanosis. Investigation of cyanosis are hematography, sepsis screening, arterial blood gas, blood culture, ECG and echo. Treatment of cyanosis: first, we should treat the underlying condition and warm application to the affected area. If the patient is affected with ventilatory causes, means we can give the oxygen, and if cold weather, means gentle warming is enough to reduce the cyanosis. How the cyanosis reduce with warm application? Cold weather, that leads to vasoconstriction. So low oxygen in the blood vessel. The low level of oxygen also extracted from the capillary into the tissue, so it leads to reduced oxygen level and increased carbon dioxide level in the capillary. The cyanosis is more commonly present in capillary rich area. And then increased carbon dioxide level, reduced oxygen level, that leads to bluish discoloration of skin and mucous membrane, that is cyanosis. If we apply the warm to the affected area, means the vasodilation is present and then increased blood supply to the capillary, So the cyanosis will reduce. This is the mechanism behind the cyanosis reduced with warm application. Cyanosis is the bluish discoloration of skin and mucous membrane. The types of cyanosis are central cyanosis, another one is peripheral cyanosis. The sites of cyanosis are mucous membrane, earlobe, nail bed, cheek, lip and tip of the nose. Reason for cyanosis is the level of hemoglobin is reduced in the capillary beds exceeds 5 mg per deciliter or abnormal hemoglobin derivatives in the small blood vessels. Question time. Cyanosis is the yellowish discoloration or bluish discoloration of skin. Bluish discoloration of skin and mucous membrane. Cyanosis due to increased carbon dioxide level or decreased carbon dioxide level. Increased carbon dioxide level. Peripheral cyanosis improved with oxygen application or balm application. Balm application. Thanks for watching.